So a key part of our services now and our strategy moving forward would be about developing new services at Ellen Badger Hospital, which is really exciting because I think there was a time when sites like Ellen Badger were really under threat in terms of the way that healthcare policy was working. But it's a really key part of our strategy now. We're really thinking about how we embed healthcare provision in the heart of the community, and Ellen Badger is so well cited for doing that as we develop our out-of-hospital services. There was a real opportunity as well for us, because one thing you'll know if you know Ellen Badger site is actually it's very landlocked and it's full. And it's full of buildings that aren't really quite the right buildings that we want now for services moving forward. There was an opportunity because some land next door became free and available and up for sale, and so we purchased that land with the help of the League of Friends. They were fantastic. They could see the opportunity and they highlighted it to us, say, look, you're landlocked as a site. This is a space bang next door. It's a big piece of space, and actually it might just be the space you need to be able to start to redevelop the site. So at that point in time we said that we were really keen to have their help and to do that, and we now own that bit of land. So we've started our plans, and we've already started by saying what we need to do first of all is get a ward that's fit for purpose, and we've just finished that development now, and the change in that ward facility has just been brilliant. You know, patients now, even our rate of falls, you know, in a facility like that you do have a certain number of patients that will fall. In the old facility it was much easier for them to fall and not be seen by the nurses, whereas the new facility has meant that our rate of falls has gone down already in such a short space of time. So that's been great. That's been our first start really on the plan. Our next bit of the plan is really now think, so what is it we need at that site? What are the services that are really important to the people that live in that area? We've had a public meeting and got some views there. We've done quite a lot of work in our out-of-hospital programme, listening to what people want in terms of services close to home. And we've been working very closely with the local primary care services as well. So the GP practice in Ellen Badger has become part of our steering group, and starting to say, well, what services would work really well on that site? And actually, would primary care also work really well? They're very capacity constrained in the buildings they're in at the moment, and that might be an option for them. And so working with them around that as well. So it's all really exciting, because actually we're going to end up with an integrated healthcare facility right in the heart of the town for Shipston. We've got a little bit more listening work to do, and I want to make sure we get it right and we do the right things and we do it in the right order. We've got a questionnaire that we're asking people now locally to complete, and people can do that and say what services they think would be useful, and we're going to put some focus groups in over the next couple of months to help with that as well. And then we're hoping that before Christmas we've got a really clear plan of what we want to put in at on site there, and what the first phase will be. We'll be able to move forward and start to appoint architects and start to design the new facility for people in Shipston.